All right, welcome to the Lazaro Lab. I'm Matt Lazaro, and Ryan, once again, is not with us. Yes, he's still alive, but he is just busy, guys, or pretending to be busy.
I think he's out there doing curls.
Probably. He can't let his biceps get too small. So today we have a new guest, Mr. Nick Huerta, soon to be Dr. Nick Huerta, in what, the next few months?
Yeah, a couple months. In May, I'll be graduating.
Nice. Yep. Yeah, man. I met you a long time ago, I feel like. Like, weren't you still in high school?
Man, yeah, I think it was in high school. Back in Max Muscle.
Oh, gosh, yeah.
Yeah, I think I just came in and was like, what can I do to get big? Trying to get big for football, and that's when we first met.
Oh, man. You know, so, yeah, you've been fitnessing for quite a while.
Yeah, I was pretty lucky, started with Vince Carter.
Oh, yeah.
Doing football type stuff.
Dude, that's wild.
And just stuck with it.
Was that while you were still at St. Mary's?
Yeah, I was a junior in high school.
Didn't you guys already have? I thought you guys had your own strength coach.
We did.
Oh, yeah.
We did.
Okay, yeah.
We did have a strength coach. Me and some other people just wanted a little more. A little different, maybe.
But squats are bad for you, remember?
Yeah, and, came to Vince and just loved it.
Yeah.
He prepared us pretty well. And ever since then, my training has, evolved from starting with Vince.
Yeah. Dude, that's back in the day. That's crazy. So to give you guys a time frame, how old? You were 16, and in a few months you're going to be graduating.
So I'm 28 right now.
28. Okay, yeah. I was like, wait. I was trying to do the math real quick, but
quite a long time. Definitely not 18 anymore. Can't go max out every day. Dude, that's for sure.
Man, those are the good old days. I remember that's kind of how Ryan and I used to always work out. It's like you maxed out every body part once a week, every week, and you just get freakishly strong. That was our version of progressive overload,
It's fun, and you feel good until you get hurt.
I was going to say, until you don't, right?
Yeah.
Yeah, dude, I remember when I remember you were posting a bunch when you were, I think you were on the East Coast, and you were lifting. You're getting freakishly strong. Did you ever make it to 500, squatting 500?
Yeah, didn't get to a 500 squat. I was trying to, I did, I think 2 squat cycles back to back. My knee just couldn't hang.
What'd you get up to though?
460 was what I got up to. Yeah.
Yeah. But what were you weighing though? You were not even that heavy.
So when I squatted 460, that was back in college in undergrad. I was like 210-ish maybe.
Yeah, it's a good size for you.
Since then, since starting med school, I've probably lost 20 pounds.
Wow. They don't feed you for one.
No food.
Shoot, all you do is, you've been doing your, what have you been up to lately? Like, because you're not necessarily in school?
Yeah.
Right?
So med school, it's the way it works is the first 2 years, preclinical. So it's all classroom stuff, traditional lectures.
Gotcha.
Stuff like that. And then the following 2 years is all in the clinic. You're at the hospitals, you're in private clinics. You're learning the trade, essentially.
Nice.
And so that's pretty much what I'm doing now. I'm at the tail end of it. So I'm just finishing up some electives, have a lot of free time.
There you go.
I'm in here quite a bit now.
Yeah.
So,
Time to pack on those 20 pounds, right?
Yeah, before I lose them again.
Oh, God. Yeah, that you ain't lying, right? So what made you want to, even go into medical school? Like, that's just a daunting thing.
Yeah.
A lot of school.
It is a lot of school. What, like 23rd grade or something now? I don't know. I was always interested in science. I knew I wanted to do biology.
Yeah.
In undergrad, I did cell and molecular bio. Thought I was going to do research, but just enjoyed medicine more. I thought it was more practical. You're not stuck in a lab, but you can still kind of do research if you want to.
Yeah.
And you're still, involved with the sciences. So that was kind of what got me interested in medical school
Nice.
versus research. I was pretty lucky. I knew like biology is what I wanted to do pretty early on. So I didn't really have to figure a whole lot out.
It's pretty damn fun. I always thought, at least, too. But
yeah. It's super cool.
The and that's led you to a lot of self-experimentation with your just physical what were we talking about? I remember you said you were doing keto for quite a while.
Yeah, I did it. I think I first did it back in like 2018 or 19. I mean, not too long ago.
Yeah.
I started, I also did a master's degree before med school. And that was kind of when I first started learning about sort of, more in depth about biochemistry, stuff like that.
Yeah.
Learning about keto, and decided to try it out then. And, I was sold. It just felt super good.
Well, what in the world convinced you that it was something worth trying?
Yeah. I don't know. I just read a lot about it.
Yeah.
All the hype. It's like the fad diet, whatever. Atkins, call it whatever you want.
Yeah.
But then started diving into like the research a little bit, and it was very interesting. There's a book, was it Low Carb Performance?
By, the art and science of low carb.
Volek, I think.
Yep.
Read that and was like, I'm pretty into exercise performance type stuff. So try it out, see how it goes.
Yeah, that's I have that book somewhere in here.
Yeah.
Somewhere. I don't
Great
know.
book.
Yeah. It was interesting. I remember experimenting with it back in, I think it was 2016, 2015 or something like that. Yeah, maybe around 2015, because it was 2015, 2016, 2017 that I stayed pretty much ketogenic.
Wow. Throughout that whole time period?
Yeah. There was some minor fluctuations, because one thing I got into eventually was the Spartan races, and I wanted to run I wanted to do all the trifecta while in keto. And I did it.
Yeah. That's cool.
But, it was, I felt great, but doing those races, and it was not just the races, it was all the accumulative training, and I got into mountaineering at the time.
Yeah.
So I thought it was great that I didn't feel the need to eat much when I was out there. So when you're hiking and climbing and doing shit for 12 to 14 hours, and you don't need very much food, you just feel good. Your energy's good. Your focus is good. And one of the things that I was remembering is that I thought maybe there was a chance it could alleviate some of the altitude sickness I was getting all the time.
Interesting. Yeah.
And it was just more of a theory, right? There's still no evidence on it either, but I felt like it felt like it alleviated some of it at times.
Yeah, that's interesting. Yeah, I've never read anything or heard anything about that.
Well, my theory was the amount of oxygen utilized for, fat metabolization. It's literally less than is required, or less oxidation than for carbohydrates. So I was like, well, maybe it'll help. I don't know. Maybe it was all in my friggin' head. Yeah.
Placebo effect is real, right?
Oh, 100%. That in itself is a really fascinating thing about research, actually. That whole placebo thing. But
I've been getting into that a lot more recently, since I've had a lot of time recently to read and stuff. And
to my understanding, there's a lot of good studies that came out of Stanford recently on that. I think there's someone that specifically specializes in researching that. Somehow, right?
Well, if you look at placebo effect, is very well established.
Oh yeah.
But then if you look at all these other research studies that do these statistical analyses, come to these conclusions, which everyone is involved in now since COVID.
Oh God! And everyone's a statistician now.
And then you just have to be very careful about how you interpret this stuff. And oftentimes it's misinterpreted, unfortunately. And what really is the truth? Because you can fudge numbers. That's easy to do. Get a p-value less than 0.05. But it's what does it really mean?
Yeah,
and that's I think a difficult thing with modern research.
Well, I would even argue just people's understanding of what placebo is probably not as sound as what it really is. How would you explain it to somebody that has no general concept of it?
Yeah, I mean, I think it's sort of tricking your mind into believing that you're receiving something that you're really not, essentially.
Yeah.
I mean, would you agree with that?
Yeah, I think so. I think there's also the element that it's like it still operates within normal physiological things that are possible,
it's
right?
Crazy, right?
Yeah, so it's not like it's saying there's no placebo to make you think you ran faster, right? Like but it's still within a range of something that can technically happen.
Yeah.
I would imagine that just that influence to create the right circumstances for it to happen, even with less of a, let's say, like a chemical influence, right? Like a drug per se.
Right. I guess we should maybe more better define what a placebo is, so it's just for the listeners.
Yeah. That's everyone's lost in it. They stopped listening, Nick. No.
So let's just say, like in the context of research, right? You have a group of people, 100 people. You're going to separate them out into 50 people in one group, 50 people in another group.
Yeah.
One group receives the drug. The other group receives nothing, or let's say. But oftentimes they'll kind of mix it up. So if the drug is like an injection, they'll give that to the group receiving the drug, and then the other group, they'll give them an injection, but it's just like saline or something, so that the participants have no idea.
Well, that's what they did with the vaccine trials, right?
Right. Yeah. Pretty much every randomized prospective trial.
And even if they're doing a pill, it's usually something.
Yeah, they'll give them
pill
something
or something like that.
But then the placebo is the observed effect that the people that don't receive anything, oftentimes you'll see sort of beneficial effects, sort of like in line if they were to receive the drug, even though they're not.
Yeah.
And so,
so that's why it's
like an example. Yeah.
It is. It's pretty fascinating too. I would even say like that effect even I think persists in normal everyday life when people make things like dietary changes and stuff. Like, just like how we were just joking, like maybe it was placebo.
Yeah.
I felt less altitude sickness. You know?
Well, I mean, it's real.
Yeah.
I mean, you know, it's like the power of the mind.
Yep.
Like, come in when you're feeling depressed, try to do a workout, you're not feeling it. And then maybe you'll come in 2 days later, feel great. You could probably do the same workout and do it like 5 minutes faster, just all based on,
your general mindset.
Yeah, your mindset.
Yeah. Yeah, that's very true, man. I mean, I feel like that's like I've had instances where like when we're mountain biking, there's certain routes that we've ran numerous times, and I know how long it's going to take.
Right.
And I know my time and stuff. And I know that some days I'm thinking, man, I don't feel that great today, right? But then all of a sudden something clicks, and I'm like, Then I pull up my stuff. I'm like, oh wow, like I actually did significantly better than I thought.
Right.
Or I did way worse than I felt.
That's more often the case for me.
Oh, God. I was just going to say, like, especially when we're doing something like it's a long climb, and I'm just like, dude, why is this taking so long?
Right.
It's like freaking microwave time. Like this, are we there yet? Like this cannot be that hard. Like I've done way worse. Yeah. So
have you read the book Endure by Alex Hutchinson?
I feel like I have. I need to check something because I have so many. I go through a ton of audiobooks.
It's kind of in line with this, but in it he talks about, I think if I remember correctly, he's talking about himself, but he was a pretty good collegiate runner.
Yeah.
And he would run the 1500 meter, and he would talk about how he would try to go sub 4 minutes.
Oh God.
And he was always stuck at pretty close, like 403, 404. Whew. Very close, but he was at, the sticking point. He couldn't get past it.
Yeah.
And then like one day he had this race, and, he starts running, and then his first lap, they give him his, his time.
Oh, his split.
His split. And it was way better than, he's ever really done. He's like, let's keep it going.
Let's keep it going.
Let's go. And he keeps going, they keep giving him these splits, and then he finishes, and it's like 3 minutes, 50, like 2 seconds. Like,
wow.
He shaved off.
Huge.
Yeah. In running, that's
huge.
People shave off like 1 or 2 seconds.
Yeah, exactly. Yeah.
Like insane. And, he finds out after that the splits actually weren't accurate.
Oh,
they were like 2 seconds slower.
Yeah.
But in his head, he's like, oh.
So he ran faster.
Yeah.
Anyways.
And it's just from thinking that he's running faster. So
oh, yeah. Yeah.
He did run faster.
You know, you want to, okay, so this is something that happens occasionally in the workouts. So sometimes when we're messing with the clock to start it, we'll be like, oh, it's not working the way I want it to work, so we'll just start at the 1 minute, right? And I forget that we started at the 1 minute, and I'm looking at the clock. I'm like, shit, man, like I'm like a minute or two slower than I thought I would be doing, you know? And then you finish, and then I'm like, oh man, I barely finished a minute before what I thought I was going to finish, and it was really like 2 minutes. 2 minutes in a 12-minute workout is a lot. It's a lot.
Yeah,
like
definitely.
And then I was like, oh man, I should do that every day. You know, like actually make me train harder
yourself. Yeah.
Yeah, but no, I mean, athletic performance, it's like a really interesting thing to dabble in all the time, right? Just kind of see where you can push yourself and stuff.
Well, it's tough too when you've been doing it for so long. You kind of feel like
get to play games with your in your head.
Get stuck at certain things and start to do things a certain way, neglect things. You know.
Oh, that's really easy for me.
Yeah.
I was like, I don't want to do it. You know, like I totally skipped today's workout, and I'm like, I had no desire to do that amount of cardio. It's a disgusting workout. But yeah, man. I mean, so you know. When at the moment you said you're getting back into keto.
I am, right? Yeah. I think like probably for the rest of my life, I'll probably try to do it at least once a year for about a month to 2 months. I don't think I could do it like, you know, for 3 years, 3 years.
It's like 2.5 years.
Yeah. I just enjoy carbohydrates too much.
I don't know what the hell is freaking. I don't know what that was going through my mind back then.
That's pretty impressive to do it for that long.
Yeah.
But, I'm doing it now, probably, you know, a month or 2 months, just kind of switch up, you know, my body's biochemistry for a bit and then, you know, switch back every year. I'm 3 days in right now. So in the throes of it.
Yeah. That's usually that's usually the part that's really hard to get through. It's usually when people say that they're on a ketogenic diet, but they're eating carbs.
And today's workout was like the worst possible workout for someone doing ketogenic.
Oh man. Or you just needed to tell yourself it wasn't.
Right. Yeah.
Oh man.
In my head.
Yeah, right. That's all, right? It's not that it's a really hard workout. Yeah. You know, I mean, so for you, what are some of the health benefits that you're looking to gain? Yeah,
so, you know, there's a lot. One of the main things is sort of just insulin sensitivity.
Yeah.
You'll see, you know, I'm sure most people have read about how ketogenic diets can help with diabetes, which is, you know, very well established, diabetes, specifically type 2.
I feel like, though, not to interrupt, that most diabetics are not educated about that.
Oh, no.
That's the wild part.
Yeah, most diabetics aren't. I mean, fat is bad is still touted as gospel, which is like complete nonsense and based on, you know, bad science. You know, Ansel Keys back in the 60s.
Yeah,
still like you see it today.
Yeah,
that, you know, still a lot of guidelines say fat is bad.
Well, you remember a couple of years back they actually changed the guidelines for saturated fat consumption. They removed it, I believe. They don't have it's not even, they used to say it was like don't consume more than 25 grams of saturated fat, and I think they removed it completely.
Yeah, that's interesting.
In 2019, I think.
Yeah. Which organization?
Like what's it called? The
American Heart.
No, oh goodness, I can't think of the freaking acronym right now. The main one,
like
the one that makes the food pyramid crap.
Yeah. I don't know which one.
Why the hell am I not thinking?
But they're all similar. ADA, AHA.
Pretty much, they all reference. They all go back to the same crap.
Like the ADA, American Diabetes Association, they didn't even recognize counting carbohydrates until like 2019 in their guidelines. Which, like, I remember I was like a first or second year in med school, and I was like, wait, what? That makes so much sense.
Why count them when you could just take more insulin there?
Right. And I always thought that was interesting.
And
I think the reasoning behind that is there's not a ton of evidence, you know, like huge prospective trials.
Yeah.
But it's like it makes total sense if you look at the biochemistry, and there's tons of, you know, smaller studies, and then now it's, I think, pretty well accepted.
Yeah.
That low carbohydrates are beneficial for.
Well, anyone in dealing with metabolic syndrome, right?
So,
but that's kind of one of the reasons I wanted to bring you on, is because I feel like you've had a lot of exposure to the general public now with working in the ER and stuff like that, right? Yeah. So what okay, like what's the most striking observance you've had in reference to being around all these sick people, I guess you could say, right?
Like, I mean, in relation to like metabolism or just in general?
Yeah, both. I mean, it does all kind of come back down to it, right? You don't see a ton of healthy people in the ER.
Also, one thing like kind of persistent throughout medicine is, you know, people of lower socioeconomic status tend to be sicker.
Yes.
And tend to group together geographically.
Yep.
You know, tons of stuff go along with that, unfortunately. And, you know, one thing, like, it would be nice to go in and, you know, educate all these patients, and then they just leave the hospital, and then they like improve in their A1C or whatever, right? But the fact is that, you know, most of these people don't have access. They don't have the money. They don't have they're working 2 jobs. Mm-hmm. They don't have the time, or even like the very educational background. You know, I've gone through with patients, teaching them how to read a nutrition label. They're like, what's a carbohydrate? Mm-hmm. What is a fat? Mm-hmm. And so I think that's like the biggest observation I've seen, because it's very easy for us to say, let's just eat ketogenic, cut out carbs.
Yeah.
We're, you know, pretty well educated. We have the means to do so, but like the vast majority, at least in my experience, you know, just the last 2 years, a lot of people kind of don't really have the means to make those changes.
Yeah.
Whether it be socioeconomically or like educational or things like that.
I completely agree. I mean, because, you know, I'm born and raised on the south side of Stockton, like in the hood, like legitimately. And it's like, when I go back home and I observe my neighbors, and I observe the people that are still living there, and I observe my friends or family that still live in similar circumstances, it's a very common theme, right? It's just I just wonder like what actually has to change,
right?
Like that change,
especially like when it comes to food, all the cheap stuff is the sugary processed stuff.
It's all the subsidized.
So when you're like pinching pennies, what are you going to go for?
Yeah,
you know, you got to feed your 2-3 kids. It's
Top ramen is very much more cost effective at the end of the day.
Yeah. I mean, it tastes pretty good too, to be honest.
Oh gosh, yeah. It makes you feel so horrible. It makes me feel so horrible. I don't know, man. But yeah, you know, I mean, but it's funny. It's like it does also come down to the educational side of things, because like if you're counting, you know, the amount of dollars you're spending on calories, absolutely buying processed food. If you're spending money on the amount of nutrients from a nutrient density standpoint, then you're definitely better off buying meat and vegetables and stuff like that. But I know it's possible. It's just not going to be that common, right? Because you know, living circumstances and whatnot. I don't think a lot of people, at least where we're at in this hoity-toity gym, know what it feels like to be poor, like legitimately poor.
Agreed.
Yeah, but it's amazing though that like how it influences your health so quickly.
Yeah.
I mean, because like, were you like age wise, like was there like an age group that was there more or less? Or
I mean, by and large, it's all, you know, elderly people in the hospital. But you know, occasionally
like 60s.
Yeah. Like I guess sometimes 50s, 60s. Yeah.
Nick says if you're in your 50s, you're elderly. No, no, I'm just joking.
It's all relative.
Yeah.
No, but like, you know, I think everyone should try to live to be 100 years old.
Yeah.
I'm sure you've heard like Peter Tia talk about the Super Centurion Olympics.
Yeah.
You know what you should achieve to do at 100.
Yeah.
You know, get up off the ground unassisted. Stuff like that. It's possible if you treat your body correctly.
Yeah. Well, it's funny. Like I did this, I saw on Squat University, they did this like, shoe thing. Like you have your socks and shoes off and it's the balance test. You put your sock on your shoe with one foot up. And I was like, this is kind of silly. So I'll just do it, whatever. And then I got all these messages, like there's a lot of comments, but the messages directly to me were funny because they were like, I tried it and I literally couldn't do it. I'm like, wow, how could you not do that? It's such a simple thing.
Yeah.
And then I was like, huh. And these are not completely unhealthy people, to be honest. That's it. I was thinking, I'm like, wow, and this actually goes back to some of the things I always think about too. When people tell me, oh, I eat pretty good. I'm kind of healthy,
like that all the time in the hospital.
But I don't know why I'm so sick.
Drinking a Starbucks drink with 60 grams of added sugar. Like, I eat healthy.
Man.
Do you know what the daily recommendation for added sugar is?
I didn't even know there was a daily recommendation.
Yeah, so they are not recommended, like limit.
Okay. Okay. I was like, whoa.
Do you know what the limit is?
No.
So it's around 15 grams. It's different for males versus females. But around 15 grams. Last I checked, it might have changed in the last year. And then, do you know what the average actual consumption of sugar is?
I'm going to guess like 75 grams.
Yeah, I think it's around like 65 grams.
Yeah.
So like well above the daily,
like 5 times the normal
limit.
amount.
Yeah, and it's like literally one Starbucks drink is going to have, I think one pump.
Or enough for a week.
One pump has like 16 grams of sugar, and people are getting
that simple
4
syrup.
or 5 pumps. Yeah.
Have you looked at a lot of the stuff that the fructose research?
Yeah.
That stuff is terrifying to me.
Yeah, they did. At my university, one of our faculty members is pretty big. It wrote some books.
Nice.
Yeah. So,
shit! I didn't know that.
Yeah, we're pretty lucky. Yeah, we got Robert Lustig. I don't know if he's on faculty at our. He wrote.
I don't know.
His first thing was a book back in the day. Yeah. He does a lot of research in kids.
In kids. Yeah. Oh wow.
Yeah.
You know who was really big on that? Was very anti-fructose. Way in the beginning was the paleo guy.
Not the Zone guy.
No, not that guy. The other,
Chris Kresser.
No, this guy's like way before.
Yeah. Well, I mean,
even before Rob Wolf.
Yeah, I mean, fructose is.
I can't remember his name, but I don't know. But the whole fructose thing seems so crazy when you think about it.
It really is. I think it's on par with like trans fats in terms of how bad it is for you and all the
even
current
cigarettes.
research. I know, seriously, and it's in like a lot of stuff in the stores.
Well, to be more specific, because I don't want to I don't think very many people know what's the difference between different sugars and stuff like that. And I'm not even here trying to say like one sugar is better than the other, but fructose in particular, to explain to everybody, your liver has to break it down into glucose so you can actually use it, right?
Well, yeah. So fructose, just like
let the
very
dog
general
explain.
terms. So fructose, it is like more specifically high fructose corn syrup.
Yeah.
So essentially, with sugars, carbohydrates, sort of all interchangeable terms. Yes. You have like monosaccharides and disaccharides. Mono, just like one sugar molecule. Di, you have 2 sugar molecules attached, right? And what high fructose corn syrup is, it's a version of
it's one that got high.
Sucrose.
No. I'm just sorry.
So, I mean, basically,
yeah.
It's pretty addictive. But so sucrose is basic table sugar. Yeah. That's sucrose. It's a disaccharide. It's composed of a glucose molecule and a fructose molecule.
Yep.
Right. And then you have at a certain ratio though.
Yeah.
And then you have high fructose corn syrup, which like there's different kinds. I think there's like HFCS 55 and 72, or just increases the ratio of fructose to glucose.
Yeah.
So you're having much more fructose in your diet, and fructose
fructose is naturally occurring in fruits.
It's in fruits, yeah.
At a certain ratio with certain fruits.
Yeah.
But it's also paired with other things like fiber and stuff like that.
Yeah,
so
like you can't.
Well, you're also not getting 60 grams of it in an orange. It's like 5.
5, right?
Yeah.
And people are drinking this stuff. And it's just terrible, and it just has tons of ill health effects from like raising blood pressure.
Yeah.
It's associated with, fatty liver or MAFLD, the new term now, metabolic associated
That's the word.
Fatty liver, MAFLD, same thing.
Oh, okay.
Non-alcoholic.
I like the MAFLD one. Yeah, that sounds better, actually. It makes sense.
And then, that's fructose. Very bad. Also triggers, associated with pathways in obesity, makes you more hungry.
So less satiety signaling.
Leptin receptors.
Yeah.
It actually decreases your metabolic rate also.
Oh, is it the fact that is it the fact that people feel like shit, so they just move less? I think, or is it actually affect the mitochondria?
Yeah, I think it directly affects mitochondria.
Oh, that's crazy.
So slows down
mitochondria, people in your cell is the health of the mitochondria heavily dictates the health of you in general, right? Like overall, or just like it's funny. I always think every time I say the word mitochondria, I think high school biology, the powerhouse of the cell. But no, so like the funny thing is, I remember when I started seeing all these commercials on high fructose corn syrup, they're like, it's not so bad, and it just shows like people look moderately healthy. They're eating popsicles and stuff. It's okay in normal amounts, which I could say, like, look, you or I, if we ate like some high fructose corn syrup in a popsicle that was like literally like 60 calories, I'm certain it's not going to harm us.
Yeah. Well,
right.
I might even argue with that.
Yeah.
I think for the most part it wouldn't.
Yeah.
But I think we spoke about this before, but the term like TOFI.
Oh,
thin on the outside, fat on the inside.
Like,
you see these thin people that have this fatty liver and they're insulin resistant.
Yeah.
And, it's partly attributable to fructose. But I mean, we're pretty active. So,
well, that's what I mean. So
part,
it's like the energy balance. It's fairly easy for somebody like us to burn more calories than we're consuming. We don't have a problem of energy balance, generally.
I think that's like...
Well, that's the biggest issue is most people do.
I think in general terms, calorie balance is probably...
Yeah.
Like where our guidelines should focus, not on what you should eat.
No, I agree. Because if things become too ambiguous in a sense, it's just harder to like, oh, well, what about this and what about that?
Yeah.
Let's say for the general population, like it's, and this is why it's like, I have some people that get mad when I tell them it's like, you have to be aware of your calories.
Yeah.
And they're like, well, I shouldn't. It's like, well, do you pay attention to how much money you spend? They're like, well, yeah, of course. I'm like,
yeah,
it's the same thing.
That's how I don't understand. I mean, this is just me personally. I've been kind of ingrained in everything I purchase from the store. I look at
you always
ingredients.
Want to look,
I look at the macros and the actual ingredients.
Yeah.
But you see people and they like zero clue about what's in the food.
Well, so we have our InBody is interesting, right? Because it does also give you a score of visceral fat, right?
Interesting.
Yeah, so it's like on a scale of 0 to 30 or 29 technically. 29 is definitely the worst, right? 10 is what they consider average, like a healthy average. But when you start getting down to much leaner, like I'm like a 3 or something like that, or when someone's like single digit body fat, they're usually like a 2 or a 1. But most commonly, I see everybody is always in the 20s.
Yeah.
Always, no matter their weight,
yeah.
Even if they're perceivably 50 pounds overweight, or even if they're 10 pounds overweight, it's very common to see it at almost 20 at all the time. And
that's interesting, yeah.
Well, and one thing that was pretty interesting, I remember reading about how visceral fat probably should be it's a better determining factor of health than it is even just generally regular body fat.
It is, yeah.
Right. There's only so much you can do to change body fat, or depends how willing someone is, right?
Yeah. So there's different types of fat, just for the listeners. There's subcutaneous fat. Yeah. There's visceral fat, which visceral just means like organ around your
heart, liver, kidneys,
and subcutaneous fat in and of itself isn't very as much associated with certain diseases.
Yeah.
But visceral fat that's, highly associated with cardiovascular disease and all this stuff. And then also, I'm like metabolic syndrome, the waist circumference, which,
well, so like the beer belly for men, right?
Like that's also,
which is pretty common too. Like the guys, they'll have this distended belly, very little muscle, arms perceivably look normal, legs look kind of normal,
right?
But that is literally the accumulation of visceral fat there, which is
that's
pretty
alcohol. No bueno.
Yeah. Well, similarly to, the funny thing is, I think a lot of people who do drink alcohol do drink probably a lot of fructose too sometimes, or consume fructose in general.
For sure. Yeah.
And it's like a double whammy to your liver, right?
Right. That's why, so what you just mentioned, it's funny you mentioned that, because that's why, a lot of the nutritional studies you see nowadays, there's tons of confounding. And, you see like an effect, we were kind of talking about earlier, saturated fat versus unsaturated fat.
Yeah.
And changing one thing. Like, or let's say an even better one is, I know you eat meat, so, meat is bad for you. Because all the studies with people who eat plants are healthier. It's like, well, if they're already taking a dietary stance by saying they're not eating meat, they have some investment in their health.
Yes.
They're obviously going to have,
they're going to avoid things
they're obviously going to be healthier.
Yeah. Well, like the biggest one that everyone cites is those studies
like
on
Nutritional.
Is that the 7-day Adventist studies?
I think that's a different one.
Down south, there's what's it called? I can't remember the name of it. But anyway, so like the great example is they had the studies on all these community of religious people, basically, where they don't eat, they're vegetarians essentially, but they tend to also eat less. There's a huge emphasis in movement, of just being healthy, and they are usually trying to have better, healthy relationships with each other, right? Just overall. And it's funny. It's like, but they're going to only point out the fact that they don't eat meat, and they disregard all these other positive things that they're doing.
Right. Yeah.
It's like, no, it's just because they don't eat meat.
Yeah.
Like, that's why they're not evil, right? Like, we get in trouble.
But yeah, that stuff's all, super interesting.
But the Nutrirex one is interesting, right? Is that the one where they actually, oh God, I'm trying to.
I forget the specifics of that one. It's been a while since I've read that one, but it's in the same realm.
Same boat, right? Yeah. But it's funny. It's like when you adjust they've done some meta-analysis studies where they take all these studies and then they do they're like, okay, let's just look at the bulk of all the evidence, and let's level the playing field. So let's adjust for what was it, the healthy eater bias, right? So, and I think last I read, the vegans, the vegetarians, and the meat eaters that all were non-smoking, exercised, and had a very similar lifestyle thing, they all have the same lifespan. And the only difference it was, and I don't remember where I was reading this, but the vegans tended to weigh a lot less because they, on average, consumed 500 to 800 calories fewer than everybody else.
Oh, huh. Yeah.
I mean, you can't eat that many vegetables anyways.
Right? Yeah, that makes sense.
They make me too full. I can't.
Right? You're not going to go eat a plate full of broccoli.
Yeah, but then if you're but also it goes back to like your belief system. So it's like if your belief system is rooted in not doing certain things, your general life choices are going to be significantly different than the vast majority of the population.
Right. Yeah, that's why I think more general food recommendations are probably better for the population at large.
I agree.
Avoid added sugar and processed foods.
Well, because it confuses people where they're telling them, oh, red meat's bad for you. Okay, yeah, but did you know that red meat consumption's been declining since the 80s? Like it's at its all-time low, and heart disease at its all-time high. So how is that a correlation? It doesn't
continually.
But it's like that's a poor way of associating it. But the funny thing is that is the most consumed animal product out of all of them is chicken.
Oh, interesting.
Chicken is by far. So if you look at the data on calories, total calories consumed, the highest calories of food groups, in the United States, the top 5 is like chicken product, and that's basically like chicken nuggets, basically.
Right.
Corn, wheat, and what was the other one? Oh, for adults, alcohol is in the top 5, and then for kids, it was like fruit juices.
Yeah.
So you just replace one with the fermented version later
Or
in life.
imagine like potatoes, because French fries.
Oh, potatoes is up there. You're right.
Yeah.
No, 100% it is. I think it's actually top 3. So like that's the basic food groups of an American. It's like chicken products, so chicken nuggets, French fries, bread, and but even the meat consumption is not even top 30. Like red meat's not even top 30.
Yeah. Wow.
Yeah, in
I would
total calories
expect it to
consumed.
be, yeah.
I would have thought it would have been higher.
Right.
But no one talks about that. They just want to say,
I mean,
eating red meat's bad.
Red meat's bad, and the actual risk, it's all just colon cancer, which red meat is classified in the same category as hot beverages. So,
with throat cancer, right?
Yeah. And I don't want to make it seem like reducing cancer risk is not a big deal, because in what I'm interested in, living to be 100, reducing cancer risk is a part of that.
It's a part of that, yeah.
Red meat, they say it reduces cancer risk, colon cancer, by like 16%, 20%. That's relative risk. So that's the term relative.
I was going to say that.
So it goes from absolute risk like 4.08 to like 4.6 or something. 4.
So you're saying 95% chance you're okay.
Yeah. And then, and it, that just gets touted, and then saturated fat along with that, which I don't know if you want to discuss saturated fat. Also,
I like that one. Well, because that's they associate saturated fat with red meat.
So that's why. So the whole thing is that, cholesterol, right? Everyone, eggs are bad, which eggs are not bad. So cholesterol, highly associated with cardiovascular disease, LDL. I'm sure that's the term most people have heard. It's low density lipoprotein, which is just it carries your cholesterol in your blood, because your cholesterol can't dissolve in
LDL,
water.
the funny thing is, what people don't know is that's not actually the cholesterol measurement.
Right.
That's the protein measurement of the transport. Or
And there's better metrics to measure it. There's LDLP,
the particle size.
But and high LDL is research has shown it's very causal with cardiovascular atherosclerosis, which is, clogging of your arteries, to put it simply. There's no doubt about that, right? Like high LDL associated with atherosclerosis, or not even causal.
Causal.
So that's why, a lot of people take statins to lower LDL. And what we found out was saturated fats tend to raise LDL. So you're like, oh no. That means
it's associated.
They raise risk of cardiovascular disease.
Yeah.
But then, we found out, oh wait, there's different types of these LDL particles. There's small dense ones and large buoyant ones.
Yeah.
And the standard American diet, who's eating saturated fat, they're eating saturated fat in a McDonald's burger, or things like that.
Well, it's not just, they're not going and eating just saturated fat.
Right. They're eating it's what's associated with it.
Yeah. They're drinking
and these
soda.
studies don't control for that.
No.
So the standard American diet, quote unquote, those people will, I don't know if this has been proven in literature, but just, this is like my theory. Those people have higher LDL, but it's the small dense ones that are way worse, way more inflammatory. And people eating, red meat and avocado oil, or not avocado
olive
oil,
oil,
not a saturated fat. Coconut oil is what I meant.
Oh yeah.
Yeah. That probably raises the large buoyant ones. So absolute LDL goes up. Yeah, sure. But I don't think any studies have really shown that by consuming more saturated fat, it leads to actual more cardiovascular disease. It raises LDL, sure, but that doesn't translate to the increase in cardiovascular disease, because it's a different LDL.
I think a lot of the research that they took was in the Jupiter studies for Crestor, essentially. Right?
Yeah, right.
They were like, okay, so if we notice that people that have high LDL end up with heart disease sooner, we should give them a statin to reduce it. Because before that, if I remember correctly, a company was trying to make a drug that increased HDL but it was harmful.
Yeah. Actually, yeah, that's interesting.
Yeah.
No study, I don't think, has ever shown that increasing HDL leads to increased.
No, but they all know.
But having high HDL is associated with
being healthy.
Yeah.
Less cardiovascular disease.
Right. It's very interesting.
Yeah. So it's like, it's all hung up around.
I mean, there's some stuff we just don't understand.
Yeah.
I think is like the fundamental.
But it's so fascinating that I think a lot of the general perception of these things is based around, at the end of the day, like pharmaceutical consumption. Because if there was not something to decrease the LDL,
right.
I would say that maybe they would have looked into things differently.
Yeah,
maybe
agreed.
At that point.
I mean, statins specifically, definitely work. They save lives.
They reduce inflammation essentially, possibly, right?
Yeah, but there are dietary interventions. I just think, most people would rather take a pill than.
But I don't know if I remember, but I remember reading about this more, that overall it still didn't help them prevent having another heart attack. Like it extended
secondary. I'm not too sure about research on secondary prevention, but I know for the listeners, primary prevention is preventing like the first event from happening.
Yeah.
So if you've never had a heart attack, it's preventing a heart attack.
Yeah.
And then secondary prevention is like you've already had
someone has already had a heart attack.
Yeah.
They're going to put them on statins, but a lot of the times people don't even make it past the first one.
Right. Yeah. So that's funny you say that. I remember we were in this lecture and we're talking about, we see patients, we don't know what's going on. Our first time meeting them in the ER.
Yeah.
And they posed a question. How do most people with heart attacks present to the hospital?
Because they're dead, right?
Right.
Yeah.
Death.
Yeah. That's the first side effect.
I don't know like the total percentage, but I think it was 40-50%.
Pretty high,
yeah.
if I remember that. Those were some striking
most
numbers.
people would say chest pain.
Yeah. No,
shortest breath.
Yeah.
Like death.
Probably had that all the time.
Right. So
yeah.
That primary prevention is very important.
Yeah. But I mean, kind of going back to general nutritional recommendations seem to be probably the most important thing, because when you start demonizing one thing or another, you're still not accounting for the main thing. There's maybe two factors, right? Sugar consumption and total calories consumed.
Right.
But they're associated with each other, because people who tend to consume more sugars or processed foods tend to consume more calories. It's easier.
Exactly.
I mean, like if I go to In-N-Out and try to portion control the French fries, is freaking near impossible.
Yeah, I'm not. If I'm at In-N-Out in the first place, I'm not portion controlling. I'm getting 2 3x3s and 2 fries.
Yeah. Dang, 2 fries, huh? Oh man, I'll feel like an asshole if I did that.
Oh, I'd feel terrible after.
Well, it's because I'm going to eat.
Good. Yeah.
I'm going to eat whatever's left over from my kids. So too, I'm probably still consuming.
Right.
I just don't want to order for me. You know,
makes you feel better about yourself.
Sometimes.
Yeah. But I mean, I agree. I think that's the number one thing is total calories.
Yeah.
And then cutting out sugar.
Or even if you can get people to maybe consume more protein, right?
Yeah,
and
that's another thing.
That tends to lead towards better appetite satiety and just, the interesting thing about protein or foods, let's say foods that are dense in proteins that have the complete amino acids, which tend to be animal protein.
Right.
You get the vast majority of all your nutritional needs from meat.
Yeah, that's actually very interesting.
With the exception of vitamin C, right?
Yeah.
But almost everything else that you need, like for sure
I'm trying to
need.
think what else you would.
No, like almost everything. Like, because if you can even get, you're talking like everything, all the fat soluble vitamins, and if you consume red meat, you get a higher concentration of certain B vitamins with certain cuts.
Yeah.
And, that's the funny thing. It's like it's all there.
Yeah. Well, I know people that have done the carnivore diet and they feel great, which is literally just meat. Which I don't know if I'd try that, because I don't know.
So oddly enough, I accidentally did that for a while.
Accidentally?
Well, I did it for a while when I was keto, because I was just sick of eating everything else.
Right.
Like literally, I was eating like spoonfuls.
I mean, there's
of
not that much
coconut oil.
stuff, dude. I take down olive oil.
Yeah, I was doing that. I was drinking olive oil and coconut oil.
It gets old.
And then I had to like adjust to taking in so much MCT oil so I didn't shit my pants. Like, but there was a span there where I literally was just eating massive amounts of red meat, just all meat, and I felt great.
Yeah.
And that was one of the things that led me to understand that I actually do not digest vegetables very well, because all my bloating went away.
Interesting.
All my all these weird digestive issues that I had, and because prior to that, I noticed that I did not do great when I ate wheat specifically. Long story short, like I was always having like weird skin issues, like literally breakout hives. What brain fog, feel like shit. Most likely, like sugar levels were fucked for something, right?
Carb boluses and stuff.
So yeah. But it was interesting. So long story short, like there was a span of maybe a couple of months where that's all I was doing, with the occasional avocado. And I was still doing like whole eggs. And I really think the biggest reason a lot of these people feel great is very similar to why people feel great when they start a vegan diet. Like they remove the bulk of the
bad stuff, right?
Yeah, the bulk of the bad stuff that's causing these like huge fluctuations in their sugar levels, or just, it's really hard to eat too much when you eat like that at one sitting. It's very
difficult. Yeah.
I mean, I could try to eat a 4-pound tri-tip at one sitting, but I'm gonna slow down pretty quick, right?
Yeah. That's interesting. That's an interesting observation, because I have heard anecdotal stories like that where people do like carnivore diet and feel great, or even some people will do a vegan diet and feel great, and do like some other diet like keto with meat and not feel great. For whatever reason, people have different bodies, people respond to diets differently, and that's why there's not one solution. Just like same thing for ketogenic diet. Like some people they'll respond to saturated fat. LDL tends to go up in everyone, but some people it just
skyrockets.
Like those people probably should avoid ketogenic diets.
There's good evidence for that. Like not everyone, definitely not everyone should eat the same.
Right. Exactly. Yeah. And I think that like gets forgotten sometimes.
Oh man.
Even that like happens to me too. I read something, people should eat low fat. Like, blood will start boiling.
They should. No. No, but but even with when I'm working with clients, I've had clients to where, I'm like, hey, let's try this. Let's try this for a little while.
Yeah.
And then they try it and they're like, wow, I feel good. I'm like, okay. So I think that's a temporary solution, though, right? Because at the end of the day, I think as humans have been around for so long, we should have the capacity to digest and feel fine with most things.
Right.
I think that shows a robust, healthy system, right? And when you're not able to, you're just inferior genetics, right? No, that's me actually. but there leads you to believe that maybe something's wrong. And one thing I've struggled with personally for a long time is dairy. And the funny thing is, it's like pretty much all my brothers can eat dairy. My son could eat dairy. And I'm like, what the hell is wrong with me? Right? It like wrecks me.
Has it gotten worse as you've gotten older?
It has.
That tends to happen.
But interestingly enough, I've been experimenting like always, and I've always noticed that when I always had a theory like, well, there's something wrong with my digestive system, right? Like the inability to digest, maybe not produce, because even when I would take the lactase enzyme, it still wouldn't help.
Yeah.
So I felt like there was something else going on. And so I was like, I've always messed around fermented foods and different things like that. And whether that's be, probiotic supplementation or actual kombucha and fermented sauerkraut and all these things, right? All of those things I always still had like some weird reactions to. And the one common thing amongst those types of fermented products was like they tend to have higher histamine.
Oh, interesting.
Yeah, and so I would always have like this weird like histamine response, and it was always like I was like whatever. But for the most part, I felt fine. One thing I decided to finally try was actual like whole milk kefir.
Yeah.
And it was really a gamble because
how did it taste?
It's like yogurt. It's essentially watery yogurt. That's what it is. But it's unlike yogurt in most commercial settings does not actually have any active benefit at all. But this stuff is just like pouring out the thickest milk you've ever seen. And I'm just thinking, not only is that disgusting to drink, but I'm really taking the gamble. I better not have to go to work for a while if something goes wrong. But about a month of consuming it so far, I've been able to eat cheese every day without any issues.
No way. Yeah.
Very bizarre, right?
Yeah.
No discomfort, no bloating anymore, no excessive gas. Like real. And then my skin used to break out a lot, like literally break out from around the time I would consume dairy. But I don't know. I'm hoping it's going to stick, or maybe it's placebo. I just told myself it was going to work.
I think that's the direction like medicine is going, because a lot of these people would have, these different types of food sensitivities, and they all manifest differently. You had like this rash. And stuff. Some people have, pain in certain parts of their body. Some people have, brain fog, all types of stuff. And I think, traditionally that's been written off as like, you're crazy. That's not real. But now we're seeing like, you cut out this stuff and your symptoms go away. There's and then you bring it back in and they come back. There's something going on there.
I have some clients right now, some newer clients that are actually they're on, what's that drug? Lyrica, right? So they use that usually with fibromyalgia for nerve pain. And I was like, hey, so have you ever thought about like really maybe just a food elimination diet? Like, have you considered it? Because I was like, you're obviously seeing me because something's wrong. and then because they said that they just feel like shit all the time. Basically, they're like, I'm having a hard time just getting stuff done. I'm like, well, let's just try to eliminate a bunch of foods and see what happens, right? Lo and behold, remove all like the grains and anything that could be of a processed sort, and plenty of fruits, vegetables, and meat and whatnot, and almost it's funny. I didn't ask anything about their fibromyalgia, right? I'm not treating anybody, but then they're volunteering information about how they stop taking their medication because they feel fine for a change.
Wow.
Yeah, and it's really wild.
That's a very interesting pathology. Also, fibromyalgia.
Oh, that's like, do they even know what it really is? Like, that's one of those things that's just like a general term for people that are always...
For the listeners, fibromyalgia, it's basically, you have all these like tender points all over your body, and you have, fatigue and, sort of all these symptoms like Matt's describing. And I think people think it might be associated, something to do with like phosphates, some sort of some micronutrient like disposal or pathway. But people don't really know. People just have this pain and don't really know what to do. But like you're saying, food.
Yeah, it's just interesting. Like maybe something in their diet was causing some excessive inflammatory response that wasn't being regulated properly. But I've seen that with other clients that have had like lupus, and I mean, you name an autoimmune disease. I've had somebody that I've worked with that noticed the difference when they changed their diet.
Definitely.
Literally within days, though. Like it's pretty instant.
And most people are pretty hesitant for that kind of stuff until they get the results. And they're like, oh, wait, food actually is a big deal. Yeah.
It's like, who would have thought what you put in your body has a chemical response.
Yeah, right. So have you heard of like the longevity performance paradox? How basically, for performance sports, top CrossFit athletes, running marathons and stuff, those guys got to eat, thousands and thousands of calories.
Oh, absurd amounts of food.
Just to, maintain their output. But the longevity performance paradox, that it says, you would think that most of those guys are pretty healthy. They're out there killing themselves, and they are. They're
for
definitely
now.
healthy.
No.
But most research shows that actually like decreased calories are beneficial for like living longer. Over the long term. So that's sort of just this little paradox that's interesting. There's actually another paradox that like in like hospitalized, very sick people, like people with heart failure. Overweight people, like with heart failure, for example, tend
to live longer,
to have better outcomes. So we're talking BMI from like not necessarily super obese, but like 25 to 30. And they think that just having that
mass,
like, because you're at that point, you're already like this chronic inflammatory, you already have this heart failure, and that places your body under a lot of stress. So having that extra fat allows your body like extra energy to utilize.
Yeah, to compensate basically.
Yeah, it's very interesting.
Yeah, there's also I do remember reading about that because God, what was it? I think there was something else about the obesity paradox, right? Like how certain people are obese by standards of BMI, but are actually fairly healthy and live normal lifespans without additional, pathology, like early onset pathology, right? Like, they're not, because everyone essentially dies of the same thing. Just you're either going to die from it
when it happens.
Yeah.
Essentially.
We want to delay it.
Yeah. So that's like successful aging, right? Is you're preventing the onset of illness, and then also like extending the number of years you're living.
Yeah, but even
like active, functional years.
Yeah, that's what I was gonna say. So what we call that health span,
right?
Like so your quality of life, like
exactly.
It's pretty crazy, like to think like I know I've seen a lot of people live into their 90s, but by the time in their 90s, most of them are not doing much.
Right, exactly. And I think even in terms of healthcare spending, a huge percentage of healthcare spending is spent like in the last year of life.
Yeah, dude, I remember reading that the amount of money spent in the last couple years of life exceed your total lifetime expenses, period.
Really?
Yeah. Which kind of makes sense if you think about it.
Yeah, I mean, people definitely utilize, the healthcare system more as they get older.
Yeah.
But I don't know.
Probably should do it the other way around, but
like throughout
preventative.
Right. Yeah, preventative. That's
the only type of medicine practice that's everyone exclusively acknowledges as preventive is dentistry.
Yeah.
That's it. Like really, like like everyone knows you should brush your teeth so you don't have to go to the dentist.
Right.
Not that you don't have to.
I was reading this thing about flossing. I guess flossing like isn't.
It's not that good for you.
People think, it's touted as.
Well, I don't do it much, so.
Yeah, I don't know. I just read some headline,
that's interesting.
Clickbait headline.
Fall
in the trap.
I can't help but read.
It happens to me all the time. Reddit.
Oh no, yeah. I try to stay off of there.
Oh, me too. Yeah, I don't have any. I just have Facebook as my only social media because.
Really?
Yeah. Because I mean, if you count Reddit, that's.
No, that's kind of. Yeah. You're not really communicating with people.
Yeah.
If you are, that's like commenting on YouTube.
Right. Yeah. No more Instagram. I couldn't do it. All the fake science and from.
I honestly, when I get on, I just post stuff and try to get off.
Yeah.
Like I really try not to. I really try not to read anything because it just makes me mad.
Exactly.
Because and at least on Facebook, I don't even see any of it. But on Instagram, like shit that I don't even follow is still popping up, and I'm like, what is this crap?
Plus, then I see all the gym videos, and it makes me feel bad about myself about how
weak I like 16-year-olds out snatching us and
right. It's actually pretty interesting since I've lost 20, 25 pounds.
You're still freakishly strong.
Yeah. One thing I've noticed, my squat strength has gone down a little bit, but my pulling strength, like my deadlift and clean and, pulling off the ground hasn't really changed a whole lot, which is very interesting to me. I can still, deadlift and clean kind of what I used to.
That's interesting. I wonder.
Like, I was thinking, I don't know, some sort of, I mean, I eat hypocaloric for the most part, most days. And like back in the day when I was training a lot in college, I was definitely not eating hypocaloric.
Eating everything.
Yeah. Probably drank a little too much too.
Yeah, we all did.
But, I think part of the reason for that maintenance of, posterior chain strength might be like evolutionary. So, if you're starving in the wild, you still need to run.
This is
and you're
true.
Using, like your extensors and I don't know.
Yeah,
It's just,
that's interesting.
Conjecture, but
Also, the development of those muscles over years, though, it's not just the muscle; it's your tendons and the tendon strength, the tensile strength, and stuff like that. I don't think that really goes away right away, and especially when you're pulling. I'd imagine that movement, when you're good at it too, understanding the mechanics of it, like that's a huge thing too.
Well, also what's interesting is like the difference between muscle size and muscle strength, and one does not mean the other.
The best damn Olympic weightlifters I've seen don't look that great, like physique wise, at least perceive. They're in great shape, but when people look at them, they don't think like, oh wow, they can clean and jerk 400 pounds. They think like, oh, they're kind of in shape. Like
strength is a very interesting trait. It's like, what is it? Is it like neural adaptation or?
Well, it's interesting too. Like specifically to let's say weightlifting. I remember I was reading something that Andy Galpin. He's a oh God, what is he? He researches like sports performance stuff, and then they specific to athletes, and they did some muscle biopsies on Olympic weightlifters, and they were like 98% fast twitch. Absurd. No other sport was close. Like literally not even remotely close.
I'm trying to think what else would even be like sprinters, I guess.
Even short them, distance. They were still not even that close. Them and throwers, right? Like the hammer throws and stuff like that. They're kind of like the next in line, if I remember correctly. But it's pretty fascinating. Even that they were even talking about how that can change over. Like you can be born with a certain amount in. There's even this in between fiber type that's
like type 1, type 2A, 2B.
Yeah, and then they can change, so you can become more dominant on one end or the other. But I don't know. Like it's a lot of it is neurological. A lot of it's just maybe bone structure, mechanics, and it always fascinates me when I feel stronger because I'm like, how come I can't always feel like this?
Right. Or even the day, right?
Yeah.
Like some days.
Or time of day.
I can't even deadlift, 400 pounds, which is, for me, that's not a super heavy percentage. And the other days, I'm repping it out for, 5-8 reps.
Yep.
Pretty easily. And it's like, why is that? What's responsible for?
I remember one week I pulled like 475 for a triple, and I was like, wow, this is great.
Right.
And then without a belt too, I was like, damn. And then I tried, and then I remember doing the workout, and there was 315, and it felt heavier. Awful, and I was like, what is going on? I'm like, did I lose it all? Like, yeah.
Some bad sleep the night before.
Probably, but all the variables, right? Like, it's funny, and I like deadlifting. It's like the only thing I'm decent at. Like, I say decent just because like my squat's not as big as my deadlift, right?
Well, everyone's good until you compare to someone who's a lot better than you, right?
That's so true. Oh God, yeah. I try not to. Yeah. It's good for me.
Exactly. That's how you end up getting hurt. That's how.
Yeah. You would think I would slow down considering how I'm almost 40, and it's just like. Nah,
you're in great shape for.
It's all show and no go, bro. Like, it's funny too. It's like I was talking to our brother about this. It's like we spent a lot of years early in life developing a lot of muscle tissue. Like if we look at from the time that we were like 13, 14, like starting to hit puberty, all the way till I was like 19, 20, literally all that time was spent just eating an absurd amount of food, and gross amounts of protein, and just lifting as much weight as possible.
Right.
And then so it's just like that's what I try to explain to people. I'm like, look, it went from being 120 pounds to 250 pounds from the age 14 all the way.
You got up to 250.
Yeah, 240. Wow. Damn near 250.
What body fat?
I don't know. I still kind of saw my abs. Like they were still poking a little.
Belly.
No, not quite. No. Like I was still pretty lean. I wish I had more pictures. But I felt like a fat slob because of how much I had to eat. But then when I see pictures that other people have, I was like, oh, actually, I was still same vascularity. Yeah. It's just not a cinched waist.
Right.
But that was like when I was like 19, 20. So it's just like every year gaining 20, 30 pounds over the summer or more. And
right. Well, I think also there's something to be said for starting to exercise early on.
Oh,
I think
yeah.
there's definitely some, neural changes that occur,
yeah.
Whether, in the muscle and the brain, that affects
that, along with taking advantage of the hormones present. And, I think my family has decent genetics, because I look at my son, he's only 12, and he's starting to be a little more consistent lifting weights. And he has like abs popping out, just full veins, tricep develop, just a little chest muscles, and I'm like, he's not even doing anything.
Yeah.
And half the time he's just like,
I mean, that's how humans should look, right?
Yeah.
Like,
no,
we
should.
Yeah.
Well, let's elaborate. Like if we were not
like in the wild,
yes, exactly. It's not
what we are today.
And I definitely don't want to live like that. Like, I do enough backpacking to know I don't want to live like that.
Exactly. I mean, we live way longer now, even with, all the things we're talking about today. Kind of nitpick. Makes me feel nitpicky.
It does,
like,
right?
Oh, this cardiovascular disease, fat. You're still living to be 80
years old.
Right? Like, 1,000 years ago, 2,000 years, you're dying in your 30s, 40s.
And it's funny, they're in the paleo community, they get real mad when you talk about how shorter the lifespans were generally, and they're like, well, infants and I can't, you know what I mean, killing babies basically because they didn't want to take care of them. Mm-hmm. The crazy thing is like there are good examples of some hunter gatherers that do live long, like the Maasai and the oh God. There's a couple of, it starts with the H. But anyways, but there's some really good examples where they do live just as long as we do, and they are living off the land,
right.
But I don't think that was the norm.
Oh, definitely.
You know what I mean?
Definitely
those tribes are still around because they were doing something right.
Yeah.
Whereas all the other ones.
Well, that's even like all that evolutionary bio. That's like the cause of all our disease today, like why fructose is so bad for you, because back then you would starve, so you want to eat a bunch to get a bunch of fat, so you would live and you didn't have to eat.
So it's like fruit is typically a more summer type of thing,
right?
And summer comes before fall, and after fall you go into winter, and it's like you need to get fat to survive.
Right. And I think that's like the main driving factor. I think like high fructose corn syrup, for example, that was sort of, I think that started around like World War I or II.
Yeah,
as sort of a way to feed the population. Like it was
because they were starving after a while. Yeah,
and then it just led to there's tons of food available. No one's out. I mean, for the most part, searching for food, worried about not being able to find food
in the first world, right? Like in those circumstances, which still blows my mind how like world hunger is a thing.
Yeah, I think.
It's still like,
I think I read like, this can't be like 10% of the world is starving. Is that, I don't know if that
I don't know the figures, but I remember this tweet that went out from the one of the organizations that helps supposedly, that they were saying if Elon Musk spent a certain amount of billions that he could solve it. And then the funny part was, he goes, well, show me exactly how, and I will sell a certain amount of stock to give you that money.
Right.
But that's the thing, like no one's figured out the logistics of how.
Well, it's tough. It's
it is.
It's very hard.
Like if people haven't traveled to a third world country, it's really hard to understand.
Right.
Anything.
Right.
Like I haven't done much.
And I know, like I'll preface this with, I don't have a huge business background, but I've read a little bit how like pharmaceuticals here, we pay a higher amount to subsidize other countries receiving like certain drugs.
Yes.
And, people always want to complain about the drug prices here, which, there's problems with that. But then what's going to happen to like the rest of the world?
Yeah.
There's just, I think, a lot of repercussions a lot of people don't think about and they're not even aware of. Well, I think their intentions are good.
Yes.
But
well, there's just a lot of money that comes out of our just that pumps out into all these other countries,
right?
And that has become more prevalent now in the sense of awareness, because just I think it's more of a political thing to make it see. Let's look at we're wasting our money on Afghanistan, political. Right? Like, I'm like, I don't think it's a waste of money, and there's plenty of other money being spent other places that probably shouldn't be. Like,
yeah, exactly. I mean, spending's ridiculous. Like you can nitpick all you want.
It's not a spend. It's not a what
spending.
It's a spending issue, not an actual.
It's a where you're putting it.
Yeah.
Issue.
Oh yeah.
We have the money. It's just where you allocate it to. And for us, it's the military, which, I understand.
There's a lot of it.
It's but what was I going to say? Oh, and then so going along with that, so if we do quote unquote solve world hunger, what kind of food are we going to give these populations? Are we going to give them high fructose corn syrup? And then instead of dying of starvation, they're going to die of heart disease. Like.
But they'll die later.
Yeah. I mean, that's just something to think about.
It is. It's all these. Yeah, it's more complicated.
Yeah,
it's way more complicated than all the virtue signaling that goes on.
Right. But it could be better, definitely.
I totally agree. But yeah, man. I mean, so it's funny. So it's like if we sum things up generally, if the majority of the population just ate less and avoided anything that had extra sugar added to it, we'd probably see I would imagine we see a drastic reduction in diabetes
easily,
like that one especially.
Yeah, and hopefully that happens. But projections now are, I think by 2030. Well, so right now, what is it? 40% of the population is overweight or obese, or
no,
is
it's
it just
more.
Obese?
I think it's more.
Yeah,
obese.
I think obese is 40%.
Oh,
overweight and obese is like
it's 56% or something like that,
which is mind-boggling. And then I think by 2030, like I forget the number, 60 million Americans. Maybe I think it's 60 million, or gonna have I think at least 2 or 3 like chronic diseases.
Oh my goodness,
which would include
2 or
like
3.
Diabetes, some types of cancers.
Well, to even go to give perspective, there's roughly 300 million people in the United States.
Right, yeah.
And
I think it was 60 million.
One of the stats I read that was crazy is that they estimate upwards of 100 million are diabetic or are going to become diabetic, pre-diabetes.
Resistance, yeah.
It's like a damn near almost a third.
Yeah.
Over a third. It's well over a third.
Totally believable.
Entire population.
Yeah.
That's not good.
Scary.
Yeah.
And everything that goes along with that.
The other thing I thought was crazy was they estimate only 3% of the population is metabolically healthy.
Yeah. I mean, how do they quantify?
Basically, they don't have the metabolic syndrome issue.
HDL.
Yeah.
Triglyceride stuff.
They exercise, have a certain amount of muscle tissue, BMI, and all these things. I wonder if our BMI would make us obese in that study.
Yeah.
Or at least I know mine. I'm at 29.
Yeah, I forget what I'm at. I'm pretty skinny now.
So yeah, you're still probably
I'm
up there.
Like 25, 24, 25.
I'm basically hovering around 6 feet, and it says I'm supposed to weigh 170 pounds.
Wow.
Yeah, I'm like I
wonder what that is based off of. I mean, it's got to be super old.
It's an old. I think it's data back from the 60s and 70s when people were legitimately smaller, but obesity wasn't really a thing back then,
right.
At all.
Yeah.
It's all of them that were kids then.
Yeah.
I think
did they just base it on like just how big the population was, or like because if
don't remember
now,
honestly.
I would be like underweight.
Yeah.
Because
God, you're right.
The point would just be moved that far.
Yeah.
Because everyone.
I don't think we should move it.
Yeah.
I think everyone should be told how much visceral fat they have for one.
Yeah, and like regularly get their labs done.
Yeah.
To make sure.
I don't know. It's crazy though. I know so many people that know that their labs are terrible.
Yeah.
And they're perfectly content with not doing it.
Well, that's why you don't. It's like the silent killer, right? Diabetes. You don't feel anything until you go blind and you get all these
and then develop heart disease,
which is like way late stage diabetes. God. But when you're 30, 40 years old, you're not really dealing with this.
Well, it's pretty wild. Like I read this report about how they've experienced the highest death tolls recently in the last few years in the 30 and 40-year-olds unrelated to COVID.
Oh.
And this is reported by the insurance companies. And so that they had...
Oh, I think I read or heard something about that.
I don't really know what they're trying to imply, but...
I mean, yeah.
I know what they're trying to imply. I disagree, but...
It's hard. It's really hard for me to make these interpretations of like this massive, essentially epidemiology. Which,
yeah.
You know...
And even epidemiology...
I mean, it's a numbers game at that point.
Yeah.
Yeah.
But I think one of the craziest things that I saw, especially after... Like the craziest thing is that I've seen, period, since everything started pandemic wise, was the increase in the average weight gain increases that happened over the last 2 years.
Oh yeah, dude, people are stuck at home.
There was a couple where in my age demographic, specifically the elder millennials, or whatever they call it. I didn't even know I was a millennial.
You're a millennial?
I guess, because I'm not 40. I'm like 38. So I'm like right on the cusp, 83, and I guess 82 is Gen.
Huh. What am I? I'm
X.
Gen.
Yeah, you were probably a millennial still. You're like 10 years younger.
I don't
than
have
me.
TikTok though, so
I do.
What is that? Oh man.
Yeah. Well,
then that makes you.
I consulted with them, so
yeah.
That's the only reason I got it. I did some seminars for them, for their corporate, and then my buddy who got me the gig, he was like, "You should probably check it out," you know. Now I'm fucking addicted, you know, like it's pretty entertaining.
Right.
And I really could keep telling myself, don't watch this shit.
Yeah.
Why the fuck am I on my phone? Oh, dude.
Like 2 hours have gone.
Oh, no. So I have limiters set on my phone that let me know if I go over 20 minutes.
Dude, and then you just knock it out of the way. And
yeah, I just say, screw you, don't tell me what to do. No, I legitimately think like I wasted that much time today. Like I am a piece of crap.
Yeah.
No. No, sometimes, but
it happens.
Yeah. But yeah, dude, we've been talking for a while.
Yeah, how long has it been?
Hour 20.
Wow.
Long enough. Yeah. I think we've lost everybody already. Nah, but you know, we'll get you back on when you're officially a doctor.
Yeah.
Did you figure out what you're specializing in already?
Yeah, so I applied to internal medicine.
Nice.
Which is sort of like general medicine.
Yeah.
And then I'm interested after, completing that training and doing possibly cardiology.
Nice.
Maybe not. Maybe just sticking with sort of primary care type stuff. So we'll see.
I'm going to need a primary. No. Oh, man. So, yeah, dude, I appreciate you coming on.
Yeah,
I know we're all over the place with topics, but I hope people found some of it interesting.
Hopefully your listeners